Good afternoon and welcome to today's webinar. This is a co-production between the Colorado Optometric Association and Colorado Access, Eye and Vision Care, Optometry within the Accountable Care Collaborative or ACC Program. Today's presenters are Dr. Chris Eddy. He's an optometrist, a past president of the Colorado Optometric Association, and Dr. Lindsay Wright. She's an optometrist with the Colorado Optometric Association and Associate Executive Director. My name is Glenda Robertson, and I'm an instructional designer with Colorado Access RICO, and I'll be your host today. The objectives of today's webinar are that at the end you will be able to describe the services optometrists can provide to ACC program patients, apply appropriate optometric referral processes for ACC program patients, and create a plan to encourage appropriate optometric follow-up care. And with that, I turn the webinar over to Dr. Chris Eddy.
Thank you, Glenda. Lindsay and I are very happy to be here with all of you today. So, what is optometry? Optometrists are healthcare providers who examine, diagnose, treat, and manage diseases and disorders of the visual system, the eye, and associated structures, as well as diagnose related systemic conditions that may manifest in the eye. Well, that is one really long sentence trying to describe what we do all day. But what does that long sentence really mean? When it comes down to it, vision drives function. Every waking moment, your visual system is driving most everything you do. Think about it. Whether you're a student in the classroom, an athlete on the court, a driver on the road, or a worker on the factory line, vision is driving what you do all day, every day. Well then, it better be working correctly. Today we'll be talking about vision at different stages of life, what non-eye care professionals may notice or should be checking for, and what our recommendations are for care.
Hi, this is Dr. Lindsay Wright. The first age group of patients we'd like to talk about today is birth to 24 months of age.
And we have our first poll. So if you would please respond either true or false to the question, a baby's first comprehensive eye evaluation should be done before the age of 1. Go ahead and click on true or false. And Dr. Wright, it looks like most people who are responding are saying, you know what, that's true.
Well, the correct answer is true. The next slide shows us why. The visual system matures in both structure and function in the first years of a baby's life. Vision and how the brain uses visual information are learned skills. Healthy eyes and good vision play a critical role in how infants and children learn to see. You can see at the different intervals how vision is developing in young children. The blue box in the top corner shows you how frequent some eye problems can occur. The presence of significant eye and vision problems in infants is rare. Most babies begin life with healthy eyes and start to develop the visual abilities they will need throughout life without difficulty. But occasionally, eye health and vision problems can develop. These are some signs and symptoms that can present in your office in this population. Optometrists are trained and ready to treat these common problems. Recently, a doctor at Dr. Eddy's office found a cancerous tumor of the eye called retinoblastoma in an infant. The child was referred to a surgeon, and although he had to have his eye removed, the diagnosis saved the child's life. As we touched on with the poll question, it is recommended that infants get their first eye exam before the age 1. Vision development and eye health problems are often easier to correct if treatment begins early. Infant and toddler exams can be some of the most challenging. However, many optometrists are available to do these evaluations, and they are available 24 hours a day for emergencies. If you are looking for a provider that can help with these infant and toddler eye health exams, the American Optometric Association has developed a list of providers that can be sorted by zip code to find doctors that routinely evaluate infants and are available for consultation. Please go to www.infancy.org to find a provider in your area, and then go to the HCPF website to see if that doctor is also a Medicaid provider. I am happy to announce that through coordination of the COA and HCPF, we were able to increase participation of optometrists over the past few years. We are at about 437 providers in 2013, and we're up to 615 providers as of now. And we're in counties all across the state.
The next stage in vision development are the preschool years, ages 2 through 5.
So we've got another poll. So click on which percentage you think is correct. According to the American Public Health Association, what percentage of preschoolers have eye or vision problems? So as people are kind of putting in their poll results, we're mixed. We kind of no one's saying 5% so far. The top vote getter right now is 15%, and then next is 20%, and then 10%, but the 20% is growing. So let's call it that the audience thinks it's about a 50-50 split between 15 and 20%.
The answer is B. 1 out of 10 preschoolers have an eye or vision problem that may be affecting their development. Vision drives function. Body movement, walking, jumping, balance, learning to read and write, all of this is happening at this stage and all driven by the visual system. Here are some signs that you may see depending on the environment you're in with patients. We, in our office, just had a 4-year-old boy come in for an evaluation in our clinic because his parents had noticed that he held books very close to his face, would rub his eyes and lose interest after only a few minutes of reading, where his brother, at that same age, would flip through pages of books for hours before losing interest. He was diagnosed with amblyopia or lazy eye, a condition that can lead to permanent vision loss if not caught soon enough.
So, as our provider network knows, that one of the things with the Well Child Check is that EPSTD screening, which has a vision component. So, we ask this question of you. True or false? It has been shown that up to 60% of children with vision problems are missed during vision screening. So what do you all think? If you think that's true, go ahead and click on the true button. False, click on the false button. And we'll give them just a little bit more time to kind of register what they're thinking. And so far the respondents are about 63% true and 37% false.
The answer is true. Even the most thorough screenings recommended by the School Nurses Association and Medicaid's EPSDT screening protocol miss 60% of the eye and vision problems, which at this stage may already be affecting a child's development and ability to perform well in school and beyond. Understanding how clear a toddler can see and how their visual system is developing can be challenging. Optometrists are trained to evaluate the visual system with a comprehensive eye exam in a way that not only determines how clear a child is seeing, like what screenings do, but also how efficiently their visual system is working and how healthy their eyes are. Optometry is here for you for acute eye conditions such as eye infections or eye injuries, or for the American Public Health Association and American Optometric Association recommended comprehensive eye and vision evaluations.
School-age children is the next age group we are going to focus on. School-age children are using their visual system 100% of the time. It is driving what they learn, which in turn drives how successful they will be in academics and athletics. Children need to have good visual acuity, eye focusing, eye teaming, eye tracking, eye-hand coordination, and visual perception in order to be effective at reading and learning. As you can see in the blue box, 1 in 4 children have a vision problem that may affect their ability to learn. There are numerous complaints a child may have if their eyes and brains are not working properly together. Did you know that many children can pass a school or well visit screening seeing 20/20 but still have an inefficient visual system? One of my patients had been diagnosed and medicated for ADHD at a young age. At his first eye exam, I found that he had a significantly high prescription in both eyes. However, his acuities were near normal. The child didn't know why it was so hard for him to stay focused at school, nor could he understand why the words on the page would come in and out of focus. After treatment with corrective lenses and therapy, over time the parents found the child to be more attentive in school, he enjoyed reading, remained focused, and was able to stop his medication for ADHD.
All right, so everyone get their fingers warmed up, and what I'm going to ask you to do is to type in your response to this question in the chat box. Again, you're only going to see what you type, and I'll see what everyone else is putting in there. But what do you think? Will a child tell you or their parent that he or she has a vision problem? Why or why not? So this is one of those things where, do they know enough to talk to their parents or their providers, and if so, why? Or do they know? They say, hey, that looks funny, Mom, Dad. Hey, that looks funny, my doctor. What goes? So some of the questions that are coming in is that they don't know there's a problem. One person said that person never did when they had a problem. It might cause confusion or embarrassment, that they just don't know that they have a vision problem. They can report symptoms, but they have to know those are symptoms. And then we have a positive, yes, if they have a good relationship with their parents and their PCMP. So what do you think? What's the answer?
Well, the answer is mixed. Yes, they may if they experience a sudden change in their vision or start getting headaches. However, most will not because they don't know the difference and don't have anything to reference what they are seeing to. Because the visual system of a school-age child is much more complex than simply being able to see clearly, optometrists are trained to not only measure the need for glasses, but also to measure how efficient a student's visual system is actually working. Please ask if a child is behind in reading ability, because 80% of children who are reading disabled, including dyslexia, have vision problems that can be solved. As you see in the box, the American Optometric Association recommends a comprehensive eye evaluation before first grade and every 2 years after, unless recommended more frequently by their doctor.
All right. Well, that concludes the kids portion of this webinar. If you have any questions for the doctors, please go ahead and put them in the chat box, and we will get to them at this point. There will be another question break during the webinar, so if you don't have a question right now, we will have another question and answer opportunity a little bit later. So we're not seeing any questions right now. We'll give just a few more seconds to see if any come in. But it looks like you both have covered the bases pretty well. So let's move into the adults.
Thank you very much. Up next is young adulthood, ages 19 through 40.
So now we have another opportunity to keep those fingers warm, especially if you're eating a cold lunch. So in the chat box on the screen this time, not in the chat box on the side, but in the screen, what do you all think the most common eye and vision problems experienced by people in this age group are? 19 to 40, again, is who we're talking about. Go ahead and type in the little box on your screen and then hit submit after you type. And of course we want to give them just a little bit of time to type. Now that we've got some things coming in, people are saying night vision problems, change in visual acuity over time. We have a couple of nearsightedness, blurred vision at a distance, myopia. And so a couple more seconds here. Eye strain. This is definitely a group that could experience eye strain. Acuity, nearsightedness. What's the right answer?
Well, the most common eye and vision problems experienced by people in this age group are due to, number one, visual stress, as in the computer use at work, and then more computer use at home. No big surprise there. And number two, eye injuries, either on the job or away from work. Good vision is important as people in this age range pursue a college degree, vocational training, begin a career, or perhaps start raising a family. Here are some signs of vision problems for this age range. We recently had a young man come into our clinic after starting a new IT job that he was quickly falling behind in. He couldn't get his work done on time. He was going home and immediately falling asleep. It ends up that he had the most uncorrected astigmatism we'd ever seen someone with his age. How he got through high school and his technical training was beyond us. The look on his face when he put his glasses on, priceless. Optometrists are often an entry point into the healthcare system. Because of this, we often see the first signs of undiagnosed diabetes, high blood pressure, MS, risks of heart disease, and the list goes on and on and on of systemic issues that show themselves in the eyes. Additionally, one more thing to remember, optometry offices are on call 24 hours a day. There is no reason for your patients to end up in the ER with eye issues. We have the eye equipment and personnel that ERs do not. If your office is called after hours by a patient with an eye problem that you have questions about, it will save time, it will save a whole lot of money, and it will improve outcomes if your office refers them to optometry clinics that are set up to see these patients. Luckily, there are optometrists across the state accepting Medicaid, and as Lindsay has already shown, how to find these optometrists in your area on the HCPF Medicaid website, searching by provider type, optometrist, and zip code.
Adult vision is an important age group to focus on next, 41 to 60 years of age. If you are over 40 years of age, you've probably noticed changes in your vision. Beginning in the early to mid-40s, most adults may start to experience problems with their ability to see clearly at close distances, especially for reading and computer tasks. Along with these changes in near vision, there is an increase in the incidence of eye health problems during these years. Chronic systemic conditions such as diabetes or high blood pressure can affect the eyes and can be found by optometrists. Health conditions like high cholesterol, thyroid conditions, anxiety or depression, and arthritis also impact the eyes. Nearly 40% of newly diagnosed patients with MS present with an eye issue as their first complaint. On this page, you can see some signs and symptoms often found in this age population.
All right, so we're testing your knowledge again. Tell us, true or false, medications have side effects which can impact sight. Oh, the responses are pouring in, and I think we have, not surprisingly, a pretty educated audience because we have 100% response so far of true.
Well, they're correct. The answer is true. The list of medications with ocular side effects is very long. For instance, cardiac and arthritis medications, birth control pills, and even antihistamines have potential ocular side effects that can affect sight. Additionally, commonly prescribed psychotropic medications have the potential to induce numerous unwanted side effects. It is not uncommon for me to see a patient on psychotropic meds come in with the difficulty in reading after initially starting their medications. Optometrists monitor, watch for these ocular complications, and treat these side effects while keeping in contact with you along the way. Whether or not there is a need for eyeglasses, adults should be examined for signs of developing eye and vision problems. A comprehensive eye examination is recommended at least every 2 years to monitor not only for vision changes, but changes that can point to systemic issues affecting the patient. If the patient has a systemic condition such as hypertension or diabetes, they should be seen by their optometrist yearly. Limited driver license vision tests or other vision screenings are insufficient substitutes to determine if there is an eye or vision problem. Also, as Chris talked about, remember that eye emergencies do not have to end up in the ER.
Our final age range for vision changes is for those over the age of 60.
So we have another poll, and this is choose all that apply. So click on all 4, 3, 2, or just 1 to answer vision reduction may cause depression, lack of mobility, loss of independence like in driving, and or an increased risk in falls. So let's take a look at what people are saying, and goodness gracious, 100% of the people who are clicking say all apply.
That is true, all the above. It comes back to vision driving function. How would you feel, for example, as a patient living in a skilled nursing or assisted living facility if you couldn't see? How social would you be? How active would you be? How engaged would you be? How comfortable would these patients feel with going up and down stairs? Transitions from carpet to tile, transitions from bed to chair. How comfortable would they be doing all this if they couldn't see? These vision changes that happen when we get older don't have to affect our independence. They don't have to compromise our lifestyle. Here are some signs of eye and vision problems in this age range. Now, the tough part about age-related eye disease is that changes can be happening without the patient knowing it until lots of damage is already done. Glaucoma, macular degeneration, diabetes, high blood pressure, all of these can be causing permanent damage before the patient is aware. That's why the American Optometric Association recommends that people have comprehensive eye evaluations annually after the age of 60. In addition to monitoring age-related eye disease and the side effects of systemic disease and medications on the eyes, optometry can improve daily function. Optometrists can evaluate the visual system and help assess a person's ability to retain an independent lifestyle.
So now we come to a question break, and I do have a question for you two. A question came in saying that a doctor's Medicaid patients are being charged a sum of money for a refraction fee when they go to a standard eye exam. Do you all know if there is assistance available for who can't afford this?
I don't know about assistance. That's going to change depending on where in the state that you are. However, I do know that for most Medicaid providers, the refraction is included in the annual eye evaluation, and you cannot charge for both.
I have a member from HICPUF with us. Marcille Case was joining us in the webinar, and Marcille, I'm just going to read what you have typed in. She said, please note that Medicaid members cannot be charged for anything beyond the Medicaid copay. No refraction fees are permitted. And if patients are being charged and charged again, the patients need to call the Medicaid customer service for this.
That is a much more precise way of saying what I was trying to. Thank you, Marcille.
All right. Any other questions that you all have about the adults and getting adults in there and keeping adults out of the ER? I think that was a great point that was made as far as oftentimes people are, if it's after hours, well, you need to go to the ER. What would you guys recommend that primary care medical providers can do, like on their answering machines, to help guide people who are having eye problems to the right resources instead of going to the ER? Do you have any suggestions?
Well, on their answering machines, I don't think they need to say anything particular about if this is an eye emergency. They would just answer it as normal. And if it ends up being an eye emergency, then hopefully they would have a list of Medicaid providers in their area that are on 24-hour call for eye emergencies. And they would get to them that way.
Excellent, excellent. Another question has come in, and it says, with the refraction question, do you think Medicaid patients are not getting the refraction screening like they should under Medicaid?
I'm not sure what's meant by refraction screening. Medicaid patients, when they go in for a comprehensive eye evaluation, should all have a refraction during that evaluation.
And so it really it's regardless of payer source. All
optometrists will provide that service.
Yeah.
Correct.
Excellent, excellent. All right, just a few seconds more for any other questions that are coming in. So this is a follow-up, and I think this kind of ties in our earlier question, the responses. But if they are being told to pay the $35 fee but are declining, I think the answer to that is they shouldn't be told they have to pay a $35 fee.
Correct.
Because all they are responsible for, meaning the Medicaid members, are the standard copay.
Correct.
So that really is more of a provider specific education point is what I'm trying to say. So it's, again, that's not how the system should work. And I think, again, Marcial Case had suggested that if your patients are encountering that, Medicaid customer service is a great way to start that conversation and not run into that problem.
And educate that optometrist ultimately.
Exactly. All right, yeah, because we definitely want to get this population in to be seen to give them the best health outcomes possible. All right, I'm not seeing any. We'll have one more question break here in just a little bit, so I'm going to turn the webinar back over to you guys.
Very good. Excellent questions. Thank you very much. And that brings us to our summary. Each stage of life brings with it different demands on the visual system. Optometrists follow the American Public Health Association and American Optometric Association clinical practice guidelines for a lifetime of eye care. Because eye care requires a lifetime of attention, we have our own follow-up systems already in place and routinely communicate with primary care providers and other specialists, ensuring referrals and follow-up care coordination is efficiently provided. If you suspect or detect that a patient's visual system may be impacting their daily function, please access optometrists in your area via the Medicaid website. Medicaid does not require referrals for any type of eye care, and direct access to eye care is encouraged.
All right, well, we are at the end of our webinar, so are there any final questions that you would like to ask? This is a great time. And so far, nothing's coming in. Do you have any last words of wisdom for our audience today?
Well, one thing we'd like to say is that if you can only take away 3 pieces from today's webinar, please remember, number 1, ask about a child's reading ability. If they are struggling, please have them get an eye exam. Number 2, no eye care problems should end up in the ER. As we described, optometrists are on 24-hour call and no referral is necessary. And number 3, systemic conditions and medication side effects are often symptomless while doing a lot of damage. As you know, early prevention and treatment is key. We want to thank you for joining us today. If you have any questions regarding optometrist function in the healthcare continuum or another way to find an optometrist that takes Medicaid in your area, please feel free to contact the Colorado Optometric Association. Our phone number and email address are on the page, and we welcome any questions that you may have.
And I do have some more questions that are coming in. Does Medicaid require prior authorization for medically necessary contact lenses?
Yes, it does.
That was a very easy response. That's awesome. And with that, I thank you for your time and attention and hope you all enjoy the rest of your lunch.